delighted to then move on to the third speaker for the day, Dr. Frederik Seelig, the Partnerships Manager at the Global Vector Hub, based at the London School of Hygiene and Tropical Medicine. Frederik, thank you very much for joining us. And I guess over to you in terms of your Global Vector Hub and your kind of work that you're doing now with the Global Vector Hub and WHO's TDR division. So over to you, Frederik. Thanks a lot. Brilliant. Thank you.
Yes, thank you again for the invitation, for having me here today. It's quite an honor. My name is Frederik. I'm the Partnerships Manager for the Global Vector Hub, based at the London School of Hygiene and Tropical Medicine, just as Rachel. And I thought just to quick introduce the Global Vector Hub itself. It was conceived as an online platform to provide free open access to information, to resources, and to data related to vector-borne diseases and their disease vectors, particularly arboviruses. Originally, it was conceived after the Zika virus outbreak in South America in 2015-16, when it became quite apparent that no such central hub for these type of information existed. So we've been collaborating with the Global Health Network and also with Rqfiq, the spin-out company based at the London School. And we've received funding from the European Union and also from the BBSRC in the UK. So just to repeat some of the facts that you may have come across already before, that 80% of the world's population is at risk of at least one vector-borne disease. 17% of the global burden of communicable diseases is due to vector-borne diseases. These include about 450,000 people who die of malaria every year. And I'm afraid these figures are from 2016, but I'm afraid that they haven't changed that much since. And obviously, in the context of this forum, the figure of 390 million dengue cases per year has been estimated. So the risk is definitely significant, and we are hoping to contribute reducing this disease burden. In doing so, by trying to bring together researchers, health workers, cutting across disciplines, different diseases and vectors. As I said earlier, we started out with focus on Zika and other arboviruses, and this is still very much the focus of the Global Vector at the current stage. However, we will also expand to other diseases and disease vectors at a later stage. These include malaria, but also neglected diseases such as Chagas disease in the Americas, leishmaniasis, as Richard mentioned previously, and also ticks and tick-borne diseases, which is also very important, particularly in the Northern Hemisphere. So we're aiming to be the first port of call for different stakeholders, be they researchers, public health workers, government agencies, policymakers, or NGOs, that are responding to threats of vector-borne diseases. We want to build a community of practice. We are providing a platform for transparent data sharing. Centrally to our whole project is capacity building and maximize preparedness for outbreak situations. We want to build a network of vector control professionals worldwide, and hopefully the final outcome will be to reduce vector-borne disease incidence. So in the context of the COVID pandemic, last summer, we launched an early version, the Global Vector Beta, which you can access on this link shown, with the aim of providing very quick access, crucial information to key data, but also key information packs for different types of stakeholders. Because we realized that because of the pandemic, people were not receiving the type of information from the central governments, perhaps, that they may need it to continue operating vector control operations and how to how to protect themselves against vector-borne diseases. So this early version includes resources and a networking feature, and very much focus on the capacity building and system strengthening. And also it includes a global directory of training courses in medical entomology that has been developed by the Global Vector and Rqfiq on behalf of WHO TDR. And this is what I will cover at the later point in this presentation. So as I said, we provide a comprehensive repository of resources, including training and educational materials, vector control guidelines and research tools, extensive information packs, and training packages for supporting training staff, particularly on the control of vector-borne diseases, but also, for instance, how to carry out clinical studies, how to set up an insectary, how to test for insecticide resistance, really with the aim of improving and building capacity. We have over 270 resource documents currently available on the Global Vector Hub. And to give you an idea, so this really ranges from policy documents such as the WHO's Global Vector Control Response document, which is really fundamental to our whole project and which really underpins everything, every decision that we take. Also, a survey report that we conducted last summer on the impact of COVID-19 on vector-borne disease research and control operations. Perhaps interestingly for this audience, another highly accessed document was a pictorial identification key for important disease vectors in the WHO Southeast Asia region. Further entomological surveillance planning tools developed by the MEI initiative at the University of San Francisco, and also good laboratory practice certifications developed by IVCC and LSHTM and others. As I said, we're also building a worldwide global vector network where registered users can share data and information about their fields of expertise. There is a discussion forum and they can reach out to each other to form new exciting collaborations and develop new practices, projects. It also includes information on relevant academic, government and NGO industry-led organizations and institutions such as LSHTM or ARCTEC, but also employment opportunities, funding opportunities, training opportunities, really with the aim of building capacity and also improving staff retention, because that's another concern we've come across repeatedly, is that a lot of people may get trained on vector control operations, but then they move on and change their jobs to something else because there's simply not enough employment security. And this is definitely something we're trying to help addressing by providing a resource on information in these contexts. And then finally, we also provide a database on different types of vector data, such as vector abundance. I've used here the example of Aedes aegypti for the example of Colombia, where you can filter for different countries, obviously, and different disease vectors. You can search for the abundance of a vector, but also whether they have been tested for insecticide resistance, whether they have been tested for specific pathogens, such as dengue or Zika, but also more specific information if available, such as any blood meal analysis. And we're always looking to expand this to further types of data, for instance, really expanding into the entire field of pathogens, and I guess the genomic databases that are out there already, and would love to link up with these. So as I said, we are already backed by many key partners in the vector control community, and we're aiming to become the central platform, bringing together data and resources from multiple external sources for health workers, researchers, so they can all be accessed in one space. We're not trying to reinvent the wheel. So if anyone has already existing data or resources or connections they would like to share with us, please do get in touch. And we're always trying to improve closer collaboration between different groups and initiatives, and also aiming to identify knowledge gaps. And we want to make sure that any impact that arises from these initiatives is demonstrated and can be shared across every region. So just a couple of slides on outputs and publications that we have produced since our project started. So we have produced case studies on the current vector control situation in Guinea-Bissau, in Sierra Leone, and in Colombia. Also, after some natural disasters in the last few years, we created very rapidly situation reports to give an overview of the situation on the ground. So this is, for instance, Cyclone Idai in Southern Africa and Hurricane Kenneth that affected the Bahamas in 2019. And we've also published an opinion article in PLOS NTD that really brought together a broad coalition of global vector experts and really emphasized that the COVID-19 pandemic should not derail global vector control efforts. We also hosted a workshop on the impact of COVID-19 on global vector control efforts. So this is really an overarching theme that we have pursued over the last year. That was organized in collaboration with the Global Health Network and was attended by over 400 participants from 60 countries. And we had some high-level panelists, including Raman Belayudan from the WHO, Dr. Damaris Matoki from KEMRI, Dr. Grayson Brown from the Puerto Rico Vector Control Unit, and our own director, Professor James Logan from LSHTM. And it was a very fruitful discussion. We had very interesting feedback also from the users. And if you would want to watch the recording, it's available on this link shown here. We were also heavily involved in developing a massive open online course on the global challenge of vector-borne diseases and how to control them. This was launched last autumn and has been very, very popular across the globe. We have over 4,500 registered users at this point. And again, sort of really stakeholders that we try to interact with this very closely, including mosquito control associations in America and in Africa, but also APMIN in the Asia Pacific region. They were very, very positive and have asked already for reruns of this course. You can also still access the material and the link shown here on the FutureLearn platform. And then lastly, we ran the survey that I had mentioned before about the impact of COVID-19, assessing how different sectors and stakeholders groups were affected, which vector-borne diseases are most strongly affected by the pandemic, what were the gaps in knowledge and communication, and also develop robust recommendation for future epidemic preparedness. And you can also access this report on the website on the Global Vector Hub. Just briefly to highlight the key findings were that a large proportion of the surveyed stakeholders reported a severe impact on the work through the pandemic, and about 57% felt that vector-borne disease research and control operations in general were greatly or extremely affected by the pandemic. And then lastly, want to move on to the new directory of medical entomology training courses that we have developed in partnership with TDR, the special program for research and training in tropical diseases, run by UNICEF, UNDP, the World Bank, and especially WHO. So this new resource will strengthen the capacity of scientists fighting neglected tropical diseases and other vector-borne diseases. It was based on an initial survey that TDR ran with external stakeholders a couple of years ago, and where it became apparent there was no clear overview of who was providing training courses in medical entomology. And given how crucial this is for capacity building on a global scale and improving epidemic preparedness, this was identified as a key component also of the Global Vector Hub. So we updated and refined the directory and then integrated it into the Global Vector Hub platform, and it was launched in January. And here you can see the screenshot from the press release from TDR in January. So there's been extremely positive feedback already from the global community. So this is a screenshot, and if everything works now, I hope to give you, so this is the website. As I said, you can access it right now. We would only ask you to register as a user on our website, and then you can access this directory. So for instance, you have many different filter functions. If you want, for instance, find a course that includes dengue, then you have here quite a large range from different countries, including Thailand, Sri Lanka, but also the United States. You can also filter for the individual countries. So as I said, there were 32 different countries listed. A large section of these, and this shouldn't be surprising, is from high-income countries in the global north, such as United States, but also the UK. And I guess this is clearly something that in the future might need addressing, that we shift the imbalance, we shift the balance of training perhaps towards the global south, where the disease is actually occurring, and less so in high-income countries. But just to use an example here, let's say Malaysia. So here you have two different courses at different institutions. And then if you want to learn more about the specific course, you have this pop-up window which describes, is it on campus or would it be online, the specific course name, which language is the course in, it's quite important, a brief outline provided by the institution. You also have the name of the instructor and a contact email address and some keywords that help you to refine your searches. So this is quite useful, I think, for anyone who's, let's say, junior medical entomologist or would like to specialize in this area. And they can really easily find out about available courses. There should also be an opportunity, should also be information available about any study fees, which is also quite important. And really just to make the search easier for anyone who wants to work in this area. Yeah, I think these are the main things I wanted to show. Let's see if I can go back to the presentation. Yeah, okay, so this is really just to give you an idea of what the directory can do. And as I said, we do invite everyone to have a look around. And also, if you know of your institution that it has a course that might be related or might be relevant for this directory, but isn't listed yet, please do get in touch. We are currently finalizing the SOPs together with TDR, which we will publish very shortly. And then once we've done a quick validation, we will include any new courses in the directory and expand it. Just to wrap up, so this is our team based at Rqfiq and at the London School of Hygiene and Tropical Medicine. This is all led by Professor James Logan, who's, as of this month, actually he stepped down as head of Department of Disease Control, but he's still the director of the Global Vector Hub. As I said, I always invite you to follow us on Twitter, where we have lots of very quick and rapid updates. We'd always encourage you to register as a user, both as an individual or your work or your organization. And as I said, once the full networking functionality has been expanded, you'll be able to provide much more information and have the capability of really conduct really in-depth networking and connecting with other stakeholders and researchers. Same if you're interested in featuring your training course, or if you have any data you would like to share with us, please do get in touch by sending an email to the email address shown here. And there's also a contact form on the website. And with that, I'd like to end. Thank you all for your attention, and I look forward to taking the questions. Thank you.